person who writes one column a week, one editorial, goes on TV practically every day, and I never go on Twitter. I don't even know what Twitter is for sure, so I'm an antediluvian. I do have a Facebook account, never check it, so and I can barely keep up with what's on the internet on the familiar sites like Speakers.com. So I guess I'm information starved, but on the other hand, I frankly can't absorb everything that there is around. I mean, the last column I wrote about the Part D plan, I interviewed 12 people, got assembled a stack of paper that high, and didn't go to Twitter even once. So, in any event, what I'll do something a little different from what Julie did. I'll give you where I think this whole business is at. And what's happened since 1993-94 is that I think a massive consensus has developed, almost completely bipartisan, not quite completely bipartisan in details, but on the big picture, I think there is a lot of consensus that wasn't there before on the need for healthcare reform, and therefore I think the bottom line from that is that something is going to happen this year. It may be a messy process before it's over, but I think something is going to happen. The consensus points are, first, cost. Healthcare represents 16% of GDP. It's growing at twice the rate of inflation. It's scheduled to go to 30% of GDP in a couple of decades. I forget exactly what the time is. As a result of rising healthcare costs, the two big federal medical programs, Medicare and Medicaid, plus Social Security, plus interest on the national debt, are going to eat up the entire federal budget by 2030 or 2040. They'll be 20% of GDP all by themselves, those four items. And everybody agrees this is unsustainable. So you've got 43, 44, 45 million people who are uninsured at some time in any given year. Now, some people say, oh, well, if you really pare that down, it's really only about 20 million who are chronically uninsured, and those are the only people we have to deal with. However, anybody who's this is a changing cast all the time. So what the consequence of having so many people uninsured, they get care, they go to the emergency room, it's deeply inefficient, their healthcare outcomes are much worse than insured people, and they cost shift onto everybody else, raising everybody else's insurance premiums, because the hospitals and the doctors who take care of them just charge extra for the people who are covered by insurance. So we're all, in effect, paying for these people double time. Some with tax money, some with higher insurance premiums. Corporate America wants to be relieved of the increasing health insurance cost burden. State and local government wants to be relieved of Medicare burdens. Lots of provider groups want to get paid. They're tired of uncompensated care, having to treat people who are Medicaid patients. Medicaid doesn't pay enough to pay the freight in lots of places for the service that a hospital provides, so or a doctor provides. So they want to get more money. So there is a large consensus of interest groups that have come together and say reform has got to happen now. There's a lot of consensus about the methods or some of the methods that we need to do to tackle all this. We need to have digital medical records. We need to emphasize prevention a lot more than we have been in the past to keep people out of the healthcare system in the first place, or at least delay their arrival. That we ought to increasingly incentivize keeping people healthy instead of just paying for a given procedure or a given half hour in a doctor's office. That we ought to pay doctors and hospitals for keeping people healthy and keeping them out of the healthcare system. We ought to do a lot more chronic disease management. That if you a diabetic patient, you make sure that they're taking their meds and checking their glucose levels. You can keep them from going blind and having limbs chopped off. So that's a cheaper way to go. So there's a lot, and so the question is how do you build all this stuff into a healthcare plan? And I think loads and loads of people are working on it. There are Republican plans that are in the process, and as you see, there are a lot of Democratic plans, and the administration is sort of working with, unfortunately, the Democrats almost exclusively in order to fashion a program. But after all, they did win the election, and they have majorities on both houses of Congress. But there are a lot of things that are controversial, and that what we're headed into now is the big debate over these heavily controversial items. One is, are we going to mandate that everybody have health insurance, or that every employer cover their employees, or else pay into a pool? That's one big question. The administration wants a mandate. The Democrats want a mandate. The health insurance industry wants a mandate because if everybody is covered, they're willing to concede a lot of insurance reforms that they previously fought in 1993 and 1994. The health insurance industry, the famous Harry and Louise ads, were the crystallization of all the objections to health care, and they basically are what led the way in defeating Hillary health care plan. So the insurance industry also wants a mandate. And I think a lot of provider groups want a mandate for the same reason. And there's a logic to having a mandate. After all, we require everybody to have auto insurance. You want to buy a house, you have to have homeowners insurance. So why shouldn't everybody have health insurance? Kids, young people your age, some of them think that they can go naked, bare, as they say, except that when they get sick or when they get injured in a motorcycle accident, they expect to get the same coverage that everybody else gets, but they don't pay into the system in order to provide it. So the idea is that they should be required to do so. I don't know whether there's going to be a mandate in the final legislation or not, but my guess is that everybody might not be covered. There may be escape clauses and stuff like that, but we will be headed toward universal care. Cost is a big question. How much of a subsidy are we going to provide? How much is it going to cost? The average Democratic plan is sort of ballpark estimated at $1 to $1.5 trillion over a 10-year period. CBO has not had a bill that it can actually score, so we don't know. We're not sure that it's going to come out at 1 or 1.5. I heard the other day that somebody had scored the Kennedy bill in the Senate at only $1 trillion, which I find mystifying, frankly, because Kennedy wants to subsidize health insurance up to 400%, 500% of poverty. So that's pretty big. Then there's the question of how do you pay for it. I think how do you pay for it is going to be the crucial fighting point when this debate gets over with. Everybody's talking about a public plan, and there are liberal Democrats, no question about it. There are liberal Democrats, including Senator Kennedy, including Henry Waxman, and probably Nancy Pelosi and so on, who want the public plan to look like Medicare, to be a government-run entity, which ultimately will take over the entire healthcare system, will drive private health insurance out of business, and will have Medicare for everybody, sort of like Canada has. Right now, they're proposing that they'll pay providers 10% more than what Medicare pays. Well, 3 years from now, they might decide we're going to pay what Medicare pays. It'll undercut private insurance, and they'll be out of business. So I think that the crucial issue is going to be how do you pay for this, and there are a million plans out there. I think that the public plan issue will get compromised out, and that there are enough conservative Democrats, moderate Democrats who are against the idea of Medicare kind of plan, that there's going to be something else. It'll be a public plan, maybe this co-op idea that Senator Kondracke is talking about. But I think that how to pay for this, what the offsets are going to be, who's going to get taxed, are we going to tax health care benefits, are we going to raise taxes on rich people, are we going to ration? There's an idea around that we have to put a cap on health care costs, and if insurance companies and providers don't exceed the cap, then there's going to be an automatic cutback on all kinds of and there's a whole, Senator Grassley, Senator Walks have a whole raft of solutions for cutting costs, which I, frankly, my mind can't contain, or my mind can't absorb.